We know that p53 mutations are infrequent in the chronic phase MPN, but they're frequent with blastic transformation. And that raises the question of what additional events are required for patients to progress. What we know from the data that exists, at least, is that patients with one p53 mutation seem to not have an adverse, it does not, in other words, have an adverse impact on how they do. And so that at least implicates other events occurring. Now, we've looked at this in the lab, and we've actually identified that it seems that you need two events, sort of biallelic hits to p53 to cause leukemic transformation, number one. Number two, that transformation seems to be accompanied by complex chromosomal changes. And so that tells us that there is genomic instability when the disease progresses. However, that opens up the possibility of therapeutic interventions in the sense that we can use inhibitors of DNA repair to try to cause further DNA damage that leads to what's called mitotic catastrophe. And so we did look at this in the lab, and we tested PARP inhibitors and WEE1 inhibitors, and we were able to identify that that combination does actually reduce the amount of disease and prolong survival in mice who have post-MPN-AML. Now, importantly, this concept is being translated to the clinic, and there is a trial coming forth very soon of a combination of a WEE1 inhibitor and a BCL2 inhibitor, which will include or allow for post-MPN-AML patients.